Back to the broadcast, the last loves tunakiita kipindi cha Lala Salama, but very important because what we discuss on these segments in most cases are issues that directly affect you, and issues that are important in terms of health, in terms of nutrition, in terms of lifestyle in general. That then would determine what your fate would be as a human being, what direction you'd take. And today we focus much on health. Health is crucial. Health is very important. We say that health is the greatest wealth. Just how much needs to be done towards ensuring that you're healthy. And even the focus that we'll be on, or the main focus of the day, is pretty much important because we're talking about procreation. We're talking about that extension of life. We're talking about that scenario of feeling fulfilled at that point of marriage, at that point of a family setup, the growth of that particular family. We are delving much on matters infertility in women, men, and all that. It's indeed a conversation that many would want to have in hiding, but we always say that we're coming out as a society to speak out. To speak out because there are remedies and there are solutions to some of the problems that people face. You sort of feel like you've been married for years, you've not been able to get a baby. I mean, solutions are there. It's just that you probably do not want to go an extra mile to seek the solutions. So it is important that we have these conversations this morning as we take a look at this particular story. There's a story that I captured on, or I looked at today in the morning on the newspapers. I'll be opening it up. And of course, we'll delve deep in regards to the same, or we base our focus on that. It's about the story where babies are now being sold out there, for as low as 30,000 shillings. That technically should tell you that it's because many people are not able to sire. And in this case, would love to be parents. And in this case, would want to say, okay, well, I can get to adopt a child. I can get to buy a child at a very low price. And I'm able to make this child one of my own. So infertility is one of the key things that would land people to such scenarios. But we say there's a way we can address it. There's a way we can work out around things and reduce these cases of infertility. Ngechu Wambui, Better Healthcare Clinic lead, is the one who's joining us this morning for this particular conversation. And we're happy to have you this morning. I'm happy to. Doing a great job in the market, and I think we've seen that.
Thank you.
And yes, we'd love to focus much on the aspect of infertility.
Sure.
Why infertility? I spoke to him, and by the way, let it be known very well. I spoke to him and asked him, what do you want us to touch on matters health? Health is vast. Health is huge. He picked this one. Sure. Why this one?
Okay, today when you talk about infertility, we are touching around the family setup. And like today, what's going on is allowed BBI, how you have the national conversation or something.
Yeah.
But peace of mind, depression, social well-being, all starts from the family.
Yes.
And most of our people, when they get married, they're staggering. Actually, we're saying that 15% of the couple are having difficult conceiving or having issues with infertility. And there is this misconception whereby it's being said that my wife is not conceiving, my wife is not being able to sire me child. You see your in-laws there are on your neck all the time, in the morning, midday, and in the afternoon, telling you, hey, where are my grandchildren? Okay, I want us to lay some right there and say some, okay, in our Africa setup, we tend to think that when we talk about infertility is about women not getting babies. And I want us to understand that it is a collective responsibility for us to have babies. Women have actually female factors are 30%. Male factors are another 30%.
Yeah.
Both together, men and the women together, they contribute to another 30%. So we are saying that it is shared equally. So the blame should not always be in my wife is not conceiving. Yeah. Actually, we should tell our patients when you come to our clinics, we tell them, hey, you should not say that my wife is not conceiving.
Yeah.
We should drop that one and adopt a new way of addressing it, saying we have been marrying for this quite some time. We have not managed to have a baby. Now we want to say, who is the problem? Or where is the problem?
Yeah.
And that's where we advocate and we advise our patient to, if you and your wife, bega kwa bega, come to the doctor, tell the doctor we are here. Don't send your wife to the to the doctor, accompany her to the doctor, and we'll be in a better position at least to get a long-term solution. Because most of the people are wasting a lot of money trying to treat a woman who is not sick, only because you doesn't have a baby in that family.
Yeah.
You just conclude, my wife is not, she's barren, when Tasa, those names.
Right. And you listen to some of these stories and they're heartbreaking, heartbreaking for that matter. So when you speak that way, then by the time someone is getting to that point of seeking medical advice, well, it is either the man or the woman or none of them actually. And then would want to ask, are there types of infertilities in this particular case?
Yeah, sure.
Oh, yeah?
Yeah, we can start from there. There's two types of infertility.
Okay.
There is what we call primary infertility. There is secondary infertility. When we talk about first degree infertility or primary infertility is you are having difficulty conceiving the first child. Okay. You are being unable to conceive the first child. You never got pregnant there before, and now you are in a relationship. You have been having intercourse often, but the wife is not using any contraceptives, and you're not using any protective like condoms, and the wife is not conceiving within the first 6 months. Okay. That is what we call primary infertility. There is what we call secondary infertility or second degree infertility. That is where you're having difficulty conceiving the second or third child, or even the fourth or fifth child. So you have one baby, or initially you had conceived, maybe you aborted, or maybe you miscarriaged, and now it's being difficult for you to conceive. That's when they call it secondary infertility. And the attributes or what contributes to primary infertility are the same. The same causes are the same that causes secondary infertility. So it's good we talk about the causes, and the causes are male and female causes, all factors. And the best thing for you to understand infertility, you have to first of all understand the anatomy and the physiology of the reproductive system. Yeah, when we talk about our women reproductive system, it starts from the genitals. From there is the vagina. There is the neck of the uterus, that is the cervix. From there is the orb or the uterus. You have two fallopian tubes on the right and the left, and the ovaries. That's what you call the pelvis area or the reproductive organs of a woman. So for you to conceive as a woman, each and every over monthly have to produce one egg have to mature monthly for you to be a fertile woman. Secondly, it have to travel from the ovary to the fallopian tube and meet a sperm there. Then your endometrium, the endometrium is the lining of the uterus. It have to get prepared for implantation every month. So, and the cervix have to have a passage whereby a sperm can travel from the vagina up to the fallopian tube for conception. When there is an issue with the whole program, that is the production of this, the maturity of the egg. They have a patent or a patent fallopian tube, and have a uterus where it will give a good environment for implantation. When you have the right cervix, then from there you should have a vagina. So if the whole system is okay, we say that woman is okay and she's good to have a baby. Another thing our viewers have to know is that women are born with their sets of ovaries. It's not like men, whereby men sperms are produced as they are used all the time. Men produces sperms from day one to his 90s. He'll be producing sperms. But women are born with their ovaries. If God had given you 20 babies, those are the ones you just get. Yeah, it doesn't produce more than that. Yeah, more than that. Yeah. So when you do abortion, when those girls miscarriage, when you limit the numbers, you're reducing your ovaries and you're losing your children. If God gave you 2 children, you have no chances of getting 3. So if you started with 2 miscarriage or 2 abortions, you never see a children.
So that tells me then there are causes
Yeah, there are
that
causes.
can get one to be infertile.
Sure.
There are things that we can do in terms of lifestyle
Sure.
that would get us probably to a level where we're not able to sire.
Sure.
There are foods that we can eat that would get us to that point.
Sure.
So we'd want to understand the causes also.
Yeah, the causes. That's the structural or the structure of the pelvis area. Okay, this entails maybe you have uterine fibroids. It will affect the structure of the uterus. So when you have ovarian cysts, when you have a tubal blockage, when you have issues with your cervix, maybe you have your low cervical os, or your cervix is loose, or it's incompetent, so it can't hold the baby for long. Those are issues that can cause infertility. And if I may start there, because that I think that's the most important part of this topic. What are the causes of infertility? And we start with the female causes or women causes. One is maybe you have blocked fallopian tubes. I said there earlier that women have 2 fallopian tubes. The 2 fallopian tubes from right and the left. Right. We have 2 fallopian tubes. If a woman have 1 or 2 blocked fallopian tube, that means the sperm will not be able to travel from the uterus up to meet the ovary.
Right.
If it's partially blocked, if the fallopian tube is partially blocked, the sperm can be able to swim and go to the other side and meet with the ovary, and conception takes place. Okay. But you see, the space that the sperm passed, the embryo cannot pass for implantation up to the uterus, and that's why you get ectopic pregnancy. So the baby starts growing the fallopian tube, and it's a medical emergency. Women lose their life due to ectopic pregnancy, and okay, that one you have to do surgery. Okay. There's no other way you can. When you get an ectopic pregnancy, you have to go to the theater and get that tube removed, and that fetus removed. And
in such a scenario, would one get to that point where they would not be able to sire completely, or are there chances that one can sire after getting ectopic pregnancy?
You know, what happened to your right tube might have happened to the left tube.
Okay.
The chances are equal. You might have 1 blocked fallopian tube, or 1 blocked and 1 partially blocked. Okay. The one that is partially blocked will have an ectopic pregnancy, so it will be removed. Okay. Then you're remaining with 1 blocked fallopian tube. Right. But nowadays there are some ways. It's good we talk about the ways, how do you sort out that fallopian tube that is blocked. Okay. Yeah, initially people used to do surgery to unblock the tube. And according to the research we have done, most of the people who have done surgery to unblock the tube, they end up blocking it more because of scarring tissues and adhesions that are created after the healing of the wound. Okay. So nowadays we have some ways, we have alternative ways of unblocking the tubes, and the tubes that will be unblocked are the ones that are caused by infections. That's infection like chlamydia infection, gonorrhea. They cause what you call pelvic inflammatory disease, PIDs. PIDs, when you get an STI, let's say gonorrhea or syphilis or chlamydia, they would set up to get to your upper reproductive organs, that is the cervix. Then from there they get to the uterus, up to the tubes. When they get to the fallopian tubes, we call it sarcoiditis. Sarcoiditis is the inflammation of the fallopian tubes. From there, they can cause you to have accumulation of fluid there. We call it hydrosamponix. Hydrosamponix is that water. And women will be telling you that, hey, doctor, I had infections, and I have been treated over and again, and the infection are not going. I usually have a yellowish, creamish, brownish discharge, greenish discharge, itchy genitals, lower abdominal pains, backache, all the time. Maybe if it's the left tube or the right tube, they tell you that you'll be having some pains here or here, and the backache. And when you say you're having discharge, those are pus cells. And pus cells tells you that there is an inflammation. There's a bacterial activities happening inside you. And people tell you, I feel like I have a wound inside because of those pus cells. So it will be burning, you'll be having low abdominal pains and the backache. So that one is one cause of infertility. There is another one we call uterine fibroids or uterine myomas. When we talk about fibroids, people know them like growth. Actually, initially, people never knew there is fibroids. They used to say that, I was bewitched. Mama Nani was bewitched.
Oh, yeah.
Mama Nani, it's like some stones were put there by a witch doctor or something.
Okay.
But nowadays, due to people have been enlightened, people, at least nowadays, are schooling, they can understand that's a medical condition. There is uterine fibroids, and they have different causes. They have different sizes and different symptoms. So you can't just say that Mama Njoroge had fibroids and she conceived. Mama Otieno had fibroids, she never conceived.
Okay.
Mama Akinyi had fibroids and she had miscarriage. Because the size of the fibroids matters, the type of the fibroids matters, because we have like 4 types of uterine fibroids.
Yeah.
There's what you call intramural fibroids. They grow inside the abdominal, the uterus cavity, inside there. We call them intramural. There's the other one we call submucosal, and they're subcelloso and pediculated. Some will deshape or make the shape of the uterus not favorable for implantation. Yeah, the other one will make you bleed a lot. So there's those who have heavy menses. Yeah, the other one who have clots when having menses, painful menses. Other women will think they are pregnant because they will have palpable mass. They will have mass in the abdomen. The mass will be moving from right to left. And actually, sometimes it's becoming very difficult for you to explain to a patient when she comes over there. She's telling you, hey, Doctor, I have been pregnant for the last 2 years. And I don't know what is happening. You're telling her, oh, how can you be pregnant for 2 years?
There's a problem.
Yeah, there's a problem.
Okay.
Then you do some tests there. You tell the patient, you are not pregnant.
It's a different thing.
I can't understand.
Dr. Allow me to go a little bit fast because of the time.
Sure.
And I mean, most of the people would definitely want to get to have answers out of this. In most cases, we've had lots of myths. I don't know whether they're myths or whether indeed it is confirmed. That yes, there are things that you'd eat and will probably get you to that point where you'll be infertile. Family planning for that matter and contraceptives, like you rightfully put it. We'd love to know whether in any way, long-term use of the same or, constant use of the same would get you to that point where it becomes hard for you to get babies or to sire babies once you're done with it.
That's a very good question. When you talk about infertility and family planning, and most probably the secondary infertility, and people should understand, when you're doing family planning, when you're taking contraceptives, it should be taken by those in the family setup. Not young girls in high school, not young girls in universities, because you see, those you are abusing now. And there are those who are taking emergency pills. It should be taken when there is an emergency. You can't tell me, hey, I'm buying an e-pill because I don't know whether I'll have an emergency. It's not an emergency. It shouldn't be an emergency whereby you are planning to go and have sex and take an e-pill. That when you talk about family planning, they do. It's better people understand. When you're taking hormone contraceptive, it tends to produce a lot of progesterone in your body. Hence, your body should produce the progesterone, and from there, you'll have imbalances of the, There's those people who take family planning, they can't have their menses. We do what you call amenorrhea. There are those who have heavy menses daily. There is those who tell you, hey, Doctor, I will be receiving my periods from day 1 to day 31st of that month. Daily, spotting, having clotted menses all the time. That's what you call menorrhagia. It's a hormonal imbalance. There are other people who will have a diminished ovarian reserve, whereby when you go to the doctor, you say, hey, daktari, alisema mayai yangu iko na baridi. The baridi we are talking about is the diminished ovarian reserve, where the ovaries resides. Kuna maji, those one you call PCOS, polycystic ovarian syndrome. Then you ask the question about lifestyle and eating. There is eating disorders that can cause infertility. There is bulimia and anorexia nervosa. Those are eating disorders, whereby some people are very much obsessed with eating. There's somebody who can eat, and then she becomes obese. When you become obese, it increases your chances of having fibroids, hormonal imbalance.
Yeah.
When you doesn't eat and you do a lot of exercise, you lose a lot of weight,
yeah.
and that shows that you'll not have sufficient fat to produce the hormones. Mm-hmm. So at least you'll have hormonal imbalance too when you shed a lot of weight and when you have a lot of weight. Mm-hmm. So it's good to do exercise moderately. It's good to have a balanced diet all the time.
Yeah.
It's good to observe what you eat. You see, when you have an obese baby, she's 9, she's just kapum-pum. Yeah, she starts receiving her menses at 9 years or 10. Yeah. That adds her chances of having uterine fibroids. Right. Yeah, another lifestyle cause it like, we have these slay queens. Mm-hmm. They are taking too long to conceive. Okay. They're taking too long to have babies. You say she's 35, she doesn't have a baby. Those are, it increases the chances of you having uterine fibroids.
Oh, yeah.
Yeah. So,
so the earlier you get a baby, the better?
The better, yeah.
Okay.
The more you delay conceiving, the more you have chances of having those complications.
This means from baby number 1 or generally? Like for instance, you can have a baby at say 24 and then you say now from there you're going to take a break for quite a while. Is it the same scenario as that person who probably has not had a baby right from the word go?
Sure, it's the same scenario.
Oh yeah? Yeah.
When you delay to conceive or to have a baby, you are at 35 and you are now trying to have a baby, and maybe you got a baby at Form 4, and now you say I'll be using contraceptives because I want to plan myself for my life. That one, the contraceptives themselves, they'll delay your conception in the future, and then taking too long to conceive will complicate your chances of conceiving. So it's good to, if you plan to have 5 babies, get your babies at 20s.
All right.
If you started at 22, get them. Without using contraceptives. But by there's something, the best contraceptive you can use is to be pregnant. You cannot get to pregnant at the same time.
At the same time.
Yeah.
Oh yeah.
So that's the best family planning.
Okay. That is a good way of looking at it. All right. You mentioned something to do with risk factors, and I'd love to know one. Of course, the risk factors for contraceptives we've known, the aspect of infertility, and we're probably not going to that point of seeking medical advice. Sometimes seeking traditional ways of doing it, which again works in most cases. I mean, what are the risk factors that come along with all this?
Okay, when you talk about the risk factors, are those things that tend to increase your chances of being infertile. Okay. And most of them are lifestyle changes, that is smoking, taking marijuana, taking excessive consumption of alcohol, that is in both men and women. Men and women who do masturbation. Then those people who tend to, actually even things like diabetes will increase many chances of being infertile because it reduces their hormone, the testosterone hormone. So they will have they have erection disorders. There are those men who will have what you call retrograde ejaculation, whereby the man feels like he have ejaculated and nothing comes out. Yeah, that may be caused by maybe blockage of the vas deferens or blockage with the urethra or something. An issue with maybe diabetes or previous surgical history. And to put on that, there is male. We have done so much on female, and it's good.
I thought,
I can touch a little bit on male infertility. There is what we call reduced sperm count. That is what we call oligospermia. The man, a man doesn't have enough sperm count. That is when you say enough sperm count, that is less than 15 million per sperm count.
What would cause that?
Maybe reduced male hormones we call testosterone. When it doesn't have enough level of testosterone, the male androgen hormone, it reduces your sperm counts or production, and from there you'll have a raw sperm count.
Can one have a boost of the same?
Yeah, sure. You have drugs for the same. There's those men who will have azoospermia, that is lack of sperm count. There is zero sperm count. Maybe that can be caused by blockage of the vas deferens. Maybe he have blockage in the testicles. He have varicose veins in the testicles. Maybe he have inflammation of the epididymis. Anything, and it's good men understands that there's a difference between you having a good performance at home, and having enough sperm counts.
All right.
Even if you do marathon 42 rounds
Right.
in that matter, it doesn't mean that you have
That you're good. You're capable of siring.
There are two different altogether.
Okay.
Two different things. You can have low sperm count, because sperms, they are microscopic. You can't see them unless you visit a medical doctor for checkup. Then you can have zero sperm count. You can't see. Whatever you see, just semen, the fluid that is used to carry the sperms. So that one doesn't. Then people who have premature ejaculation, when you cannot perform it, when you can, the sperms can't get into the women. That one shows that you will not make her conceive.
Okay.
Secondly, if you have erectile dysfunction, issues with erection, if you cannot do it, there's no way you can make her pregnant.
Okay.
Yeah, so there's those way you can know that, hey, if I have erectile dysfunction, I cannot perform in bed. That shows that I'm the problem.
Okay.
Sure.
All right. Well, interesting. We have about 10 minutes or so to wind up. And I'd love to know the symptoms that come along with this. I think you've spoken of the men. But the women, how do you get to know that, well, there's a problem?
The first symptom is not conceiving.
Okay.
When you've been in marriage for this long, for 6 months and beyond, and you are not conceiving, that shows you have issues with your fertility.
Okay.
When you have issues with your menses, maybe you are not having your periods, that's what you call amenorrhea. There are those who dray. She never starts getting her menses. Maybe she's 20, she have never gotten her menses even once. That's what we call primary amenorrhea. There are those who, after taking some family planning or after conceiving, they are not having their menses. If you doesn't have your menses, that shows you have issues with your fertility. Okay. Then there are those who have what we call menorrhagia. Menorrhagia is having heavy menses. When you get maybe like 10 days, you're on heavy menses. That shows you have issues with your hormones, or your uterine cavity have some issues. Okay. Then there are those who have what we call oligomenorrhea. And it's not sufficient periods. Okay. You have some periods, but you cannot say it's like spotting. Right. That's another sign of having issues. There are those who doesn't ovulate. Ovulation is another, because for a woman to conceive, she have to ovulate after the 14th day. Yeah. And when starting your days, you start from the first day. You start bleeding. That's your first day. Okay. Then the 14th day, you say that is the ovulation date. The ovulation period, yeah. There are those who will ask, hey, supposing, Daktari, my days goes up to 34. How do you count that? You take 34 minus 14. Okay. That you get to 20. That's your date of ovulation. If yours is shorter, it is 20, let's say 24. You minus 24, minus 14, okay. So your ovulation date will be 10. Okay. So the one that we talk about being 14th day is when your cycle goes up to 28 days. That one is the one we say she have regular menses. So her ovulation will be on 14th. Okay. And we doesn't advocate for those who have timely intercourse. You say, I want to abstain up to the 14th day, so that is okay. You know, that one give depression, give a lot of anxiety. I would advise and I would advocate for regular intercourse. Maybe after 2 days you have intercourse. After 2 days, because there's those people who get ovulation more than 3 or 4 days. Yeah. So I would advise people to have regular intercourse. Yeah. Those are the symptoms. Those are the main symptoms of infertility. But if you have low abdominal pain, you have cramps all the time, you have backache, you have what you call you are hairy as a woman, you have beards as a woman, that shows that you have a male androgen hormone that's called testosterone. So it can be a cause of infertility, or it is a symptom that shows you, hey, you have issues with your fertility. Yeah. Okay. Another thing, it is a miscarriage. There are those women who miscarriages. We call it spontaneous abortion. Okay. You doesn't know the cause of that abortion. Okay. You're pregnant. You just lost that pregnant all the time. That also shows that you'll have chances of not having a baby.
Blood groups.
Sorry?
The blood group?
Yeah, even the blood group,
Okay.
yeah. There's what we call lesser's incompatibility. If you are a woman there, you are lesser's negative, your husband is lesser's positive.
Okay.
That means the chances of you having a baby, the baby will be a lesser's positive.
Okay.
He'll be given by the father.
The father.
So your antigens, your body antibodies will treat the baby
Okay.
as a foreigner, and you will always have a miscarriage.
Okay.
But most likely it doesn't happen to the first baby. It happens from the second and the third going there. That's because initially, when you have a fetus in the stomach, your bloods and the babies doesn't mix.
Okay.
And that's why you can have even if you are HIV positive, the baby can be okay because your blood doesn't match. So when delivering, the blood might tend to mix somewhere.
Okay.
And your body's antibodies start realizing, we had a foreigner inside here. Okay. So next time, each and every body we get there, we shall treat that as a foreigner or an enemy. Okay. So all the time you'll have a miscarriage.
You have miscarriages.
Yeah.
All right. Well, 2 minutes or so, right after diagnosis, then what next?
Yeah, the best thing to start is consultation. You just walk in a doctor's room, you can get to better health, that's where I am. You can just come for consultation. From there, we do the lighter tests or the diagnosis.
Right.
Then nowadays there are alternative treatment. It doesn't, if you have fibroids, uterine fibroids in your stomach, you doesn't have to go for myomectomy. Okay. There is nowadays, because most of the people who've done surgery for uterine fibroids, they start growing again, they start recurring. But nowadays there's treatment for the same. There's drugs you can take and they will flush out the fibroids and you can conceive normally. There's those who also have uterine, what we call fallopian tube blockage. If you have blocked fallopian tubes, you doesn't have to go for surgery. You can take medication. You can come. We actually have very good products for fallopian tube to unblock the tubes, and you can conceive. For ovarian cysts, the same. Men who have issues with their fertility, that is oligo and azoospermia. Men who have issues with their libido. You know, nowadays men have issues with libido. Yeah. Men have issues with libido. I don't know how to put it, but the research we've done, 70% of men have issues in bed. Oh. It's chaotic. Men have issues, and that's why I would advocate for this issue. Male erectile dysfunctional issues, it should be classified as a disease, like the others. All right. If we're talking about low libido, if we're talking about premature ejaculation, let's be put it on the table. On the table. Yeah, when you're having a family gathering, it's good. Your brother there says, I have diabetes, it's having a problem. The other one's talking about ulcers. And now stand up there. And my wife is just running away. Right. I'm just poor bed. Yes. Yeah. Important that we have. On the table. And then, you know, when you talk, you start healing. Yeah. And maybe somebody there on the other table tells, hey, don't do Daktari Ngechu? Yeah, he'll fix that or something. Yeah. It's good we talk, we share. We learn away from that stigma of hiding away, crying in the bed, killing your wife. Yet the solution could be there. Yeah. Wow. Daktari Ngechu Wambui, thank you so much for the great insights. We're hoping that we're going to have you some more and more, because we realize that there's so much that we need to discuss. Sure. We also have our program Body Garage that is on Matters Health. We'd be glad to invite you for more and more sessions in regards to Matters Health. Otherwise, it was good having you. Daktari Ngechu Wambui is a specialist from Better Health Clinic. It was good having you. And of course, you want to say something? Yeah, I want to say something. If somebody would like my number. Oh, yeah, you drop your number. Yeah, I don't do this openly, but I'll allow you to do that. It's okay. Yeah, you can have my number. It's 0718 10 10 10. 0718 10 10 10. And then Facebook is Ngechu Wariandasho. You can just follow me there. Yeah. And you talk more about infertility and some more other issues. Better Health, we are located at Kayore Masimba stage. Okay. Yeah. I mean, if one is able to get help, sure. I think that is our biggest, sure. More, I would say that would be a blessing to us if someone is going to reach out to you and sure. they're able to get help. Otherwise, we're grateful so much. We've learned something, we've picked something, and like I rightfully put it, we hope to have you some more and more as we get to discuss
What Matters Health. My name is Linda Alela. That is where we get to wind up Morning Cafe this morning. I'm certain that you have gotten something that will be helpful to you right from the start up until now. Dr. once again, thank you so much. Bye-bye.